Tonight we begin with a development that Social Security advocates, disability rights groups, and millions of American beneficiaries had feared, tracked, and warned about for years. A policy shift that unfolded not over decades of slow reform, but in a single administrative cycle. A single cycle that stripped away protections that elderly and disabled Americans had counted on for decades. A single cycle that introduced new barriers that legal experts say will make qualifying for benefits significantly harder. A single cycle that could push hundreds of thousands of vulnerable people off the rolls, or prevent them from ever getting on. What the Social Security Administration did this spring crossed a line that disability advocates had hoped would hold. And when that line broke, affected communities and their legal representatives did not hesitate. They responded with urgency, with organized resistance, and with a clarity of purpose that Washington rarely sees from people who have historically been among the most politically invisible. For several years now, there had been signals, not official press releases, not formal regulatory filings, just signals that the Social Security Administration was preparing something that would fundamentally reshape how Americans access the benefits they paid into their entire working lives. The SSA has been under pressure, yes, but it has been patient in its restructuring, deliberate, almost surgical. Its moves have followed a certain rhythm, a pattern of incremental policy adjustments, staff reductions, and procedural changes that, taken individually, seemed manageable. But what set off alarm bells among disability advocates, elder law attorneys, and congressional watchdog offices this spring was that the rhythm went silent. Experts who monitor federal benefit administration know the indicators: the sudden acceleration in internal rule reviews, the reassignment of senior adjudication staff, the quiet freeze on public comment periods, the consolidation of regional decision-making authority. All of that went quiet. And then came the announcement. And whenever a federal agency goes quiet before a major policy shift, it means something is about to get very loud indeed. Early this spring, benefit law analysts detected what they described as a sweeping procedural overhaul, including new functional assessment criteria for disability determinations that had not been applied in over 15 years. These are the kinds of administrative changes that the SSA only implements when they are signaling something very specific: a narrowing of eligibility, an acceleration of case closures, or a fundamental restructuring of who qualifies as disabled under federal law. Observers and advocacy organizations did not immediately know which category this fell into, or whether it fell into all three at once. What they did know was that the SSA was changing its internal posture on disability verification, medical evidence requirements, and the weight given to claimant-submitted documentation. And when a federal benefits agency shifts its evaluative posture without extensive public notice, even by modest procedural measures, the people who depend on those benefits pay very close attention, because they have to. The alert issued by disability rights organizations this season was not routine. It was not symbolic. It was not a form letter. It was urgent. Legal advocacy group after advocacy coalition described the SSA's new policy framework as restrictive in scope, unclear in application, and, perhaps most importantly, almost entirely lacking in the transitional protections that vulnerable claimants typically need when rules change overnight. A bureaucratic shift of this magnitude only goes uncontested if the affected population has no organized voice. These Americans have one. In fact, the mobilization response we have seen in recent weeks has been among the most coordinated disability rights advocacy efforts in recent memory. Within days of the policy's formal announcement, legal aid organizations in 14 states filed formal requests for clarification. Disability rights coalitions submitted emergency comment filings. Attorneys representing Social Security disability insurance claimants began documenting what they describe as a pattern of premature denials consistent with the new standards. These weren't routine advocacy letters. These were formal legal challenges, mechanisms that organizations only deploy when they believe the government has crossed a line with meaningful constitutional and statutory consequences. Tonight, legal observers confirmed that the policy changes affect several distinct pathways through which Americans access benefits, including the medical vocational framework that had recently been considered settled law for how older workers with limited education are evaluated for disability status. Advocates began raising concerns before the new standards could be applied at scale. They challenged the functional capacity assessment revisions. They challenged the evidentiary weighting changes. they challenged the new documentation requirements that legal experts say were written without adequate consideration of the practical realities facing people with serious mental health conditions, neurological disorders, or limited access to consistent medical care. In other words, advocates targeted the bureaucratic infrastructure that makes the new policy operational, the internal guidance documents and adjudicator training materials that would have quietly translated a policy announcement into thousands of individual denials. This is what made the advocacy response so urgent. The SSA's move was not just symbolic, it was operational. It represented the kind of administrative shift that could quietly eliminate or substantially delay benefits for people who have no other means of financial support if left unchallenged. And disability rights organizations, understanding that fully, responded with precision, not with generalized protest, not with reactive media campaigns. They targeted the specific procedural mechanisms, they identified the specific regulatory language, they challenged the specific internal guidance that would have transformed a policy document into human consequences. And here is where the story becomes even more consequential. Legal analysts now believe that the SSA's latest policy framework was designed to probe the resilience of the disability rights advocacy network after years of budget attrition in legal aid organizations across the country. The question, whether explicit or implicit, was whether affected communities would have the organized capacity to respond. But instead, the opposite happened. Disability advocates did not absorb the change quietly. They issued a coordinated challenge that was so thorough, so legally specific, that even senior SSA administrators acknowledged receipt and initiated a formal review process. You do not get that kind of institutional acknowledgement easily. But this spring, the disability rights community demonstrated that it remains both legally sophisticated and strategically unified. Their filings were not only comprehensive, they were calibrated so precisely to the statutory framework that even observers skeptical of advocacy claims acknowledged the substantive merit of the challenge. That calibration matters because it shows something important. The people most affected by Social Security policy changes are not passive recipients of bureaucratic decisions. They are active participants in shaping them. As reports continued emerging throughout the spring, we learned more about the scope of what this policy change could mean in practice. Legal aid attorneys documented case files showing claimants denied under standards that appeared to reflect the new framework before the official implementation date. Advocacy researchers identified specific diagnostic categories, including certain chronic pain conditions, treatment-resistant mental health diagnoses, and neurological conditions with fluctuating symptom profiles, that appeared disproportionately affected by the new evidentiary requirements. Medical organizations reported growing concern among physicians and clinical social workers who submit documentation on behalf of patients. Professionals now facing new documentation burdens that, in the words of one disability medicine specialist, treat complexity as a liability rather than a clinical reality. This was not just a procedural adjustment. This was not just a policy update. This was a systemic redesign of how the federal government evaluates human suffering and translates it into eligibility determinations. This was a shift in moral architecture. And that moral architecture is the one thing the Social Security system has struggled to maintain as political pressure, budget constraints, and administrative reorganization have compounded since the early 2000s. For every incremental reform advocates have secured, the SSA has countered with something that quietly narrows the practical impact of those gains. Remember, policymakers have believed before that streamlining the disability determination process would reduce costs without meaningfully affecting eligible claimants. They thought more rigorous documentation requirements would only screen out fraudulent or marginal claims. They thought changes to the medical vocational grid rules would primarily affect a narrow category of borderline cases. But history shows the opposite happening, consistently, predictably, and at scale. Eligibility rates fall. Processing backlogs do not. And the people most harmed are precisely the ones the program was designed to serve. Workers with limited education, older applicants with physically demanding work histories, and individuals whose medical conditions do not fit neatly into the evidentiary frameworks designed around them. What makes this moment so significant and so charged is that the SSA's policy shift happened at a time when the agency's leadership is operating under competing institutional pressures that rarely align. Budget hawks want reduced program expenditures and faster case throughput. Disability advocates want expanded access, reduced wait times, and increased accountability in the determination process. Fiscal analysts want actuarial sustainability across a program projected to face funding shortfalls within the next decade. Medical professionals want evidentiary frameworks that reflect the actual complexity of chronic illness. SSA administrators are balancing these demands while simultaneously managing a severe staffing shortage that has left field offices understaffed and adjudication backlogs at near historic levels. And when institutions in that position make sudden policy moves, they are often not doing so from a position of confident reform. They are doing so under pressure. They are doing so from vulnerability. And policies made from institutional vulnerability tend to optimize for administrative legibility rather than human accuracy. The formal response from legal advocacy organizations, now distributed across 14 states, was designed to signal that the disability rights community is not willing to allow benefits access to be quietly narrowed without a full accounting of the impact on real claimants. Attorneys representing affected clients said plainly that the SSA's new standards were difficult to reconcile with the statutory definition of disability under the Social Security Act. That is careful legal language for something more direct. The policy as written does not match the law as passed. You do not hear that tone from experienced Social Security attorneys unless they believe the procedural foundation is genuinely unsound. Meanwhile, claimants and their advocates have been speaking publicly, in hearing rooms, in legal filings, and in communities where the stakes are not abstract. One claimant advocate described the situation in terms that were measured but unambiguous. The people facing these new requirements are not navigating a bureaucratic inconvenience. They are fighting for the income that stands between them and poverty. Another attorney noted that the new standards seem designed by people who have never had to explain to a client, someone who cannot work, who has exhausted savings, who is waiting on a determination that has already taken 2 years, that the rules have changed again. And a third voice, a physician who regularly completes disability documentation, described the new evidentiary requirements as asking clinicians to produce certainty where the science of chronic illness offers only probability. These are not rhetorical complaints. These are testimonies from professionals and affected individuals who understand at ground level exactly how high the stakes have become. Here is what makes the situation even more concerning. The SSA's new policy framework did not arrive in isolation. Alongside the changes to disability determination standards, congressional budget proposals emerged that would reduce SSA administrative funding for the third consecutive year. Staffing shortfalls in field offices worsened, with some regional hearing offices operating at less than 60% of authorized personnel, and pending regulatory updates to the appeals process would further constrain the window during which denied claimants can seek reconsideration. All of this is happening within the same administrative moment, when a federal agency tightens eligibility standards, reduces the staff processing those standards, and simultaneously narrows the appeals pathway, all at once. It means something larger than routine reform is underway. Policy analysts are now considering several possibilities for how this unfolds. One is that the SSA is preparing to conduct a formal review of its own implementation guidance, particularly if legal challenges establish procedural irregularities in how the new standards were adopted. Another is that the SSA is attempting to establish a new administrative baseline, one that, once operationalized, becomes the effective standard regardless of what the formal policy documents say. A third possibility, the one most worrying to advocacy organizations, is that the agency is attempting to shift the burden of proof in disability determinations in a way that would survive judicial review by embedding it in adjudicator discretion rather than explicit policy language. But legal advocates are already working to take that card off the table. They are not waiting to see what the new standards look like in practice across thousands of cases. They are not relying on the hope that conscientious individual adjudicators will apply the new guidance conservatively. They are not assuming that the program will self-correct without external accountability. They are filing challenges now. What we are watching is a test of institutional accountability. The SSA wants to see whether policy changes implemented through administrative guidance rather than formal rulemaking will face effective legal challenge. Advocates want to show that federal agencies cannot quietly restructure program access without triggering the accountability mechanisms the administrative law system was designed to provide. Congressional oversight bodies want to prevent changes that could generate both a public access crisis and significant long-term litigation exposure for the federal government. And affected claimants want to prevent a policy shift that, if left unchallenged, could deny them the income their work histories entitle them to under federal law. Tonight, we have heard from legal organizations who are now monitoring denial rates in early implementation jurisdictions. They say initial data suggests a measurable increase in denials for specific diagnostic categories relative to pre-policy baselines. They say the documentation burden, particularly for claimants without consistent access to specialist care, is already creating disparate impacts on low-income applicants. And they say the SSA's decision to implement the new framework without an extended transition period is likely part of a broader administrative strategy intended to establish precedent before legal challenges can mature. But disability advocates are not waiting passively. In fact, they are building the evidentiary record they will need for sustained litigation, case by case, filing by filing, claimant by claimant. Their response this spring, legally precise, organizationally coordinated, and grounded in the lived experience of